majina ni James Kafue Jage, one of the community health promoters from Kenya unit. Leaking facility ni hapa Wamagana Health Center, na fanya kazi ya community health promoter, na hiyo kazi naipendelea sana. Hodi kuo. Nashiko. Ureo kuo. Wega. Thank you niko gukora. Ni hingo ndiracoka. Wakia maitu. Ni ndoka nigetha tuthie na mbere na ithimi iria citu. Ngwendaga tuthime cukari na pressure. Kwega muno.
Under the docket of health, the government of His Excellency is very passionate to improve the health of the Nyeri people, and has a lot of political, financial and logistical goodwills in support of the community health promoters as they carry on their duties.
Njĩtagwo Beatrice Mumbi wa Mũrĩithi, gũkũ gwĩtagwo Wamagana na nĩ Tetu, na tũmenyete na Kafue ihinda inene kuma 2012. Nĩ okaga agathima, rĩmwe agoka agakora ĩrĩ igũrũ, ngaheo marũa akaniribaro Wamagana, ngathiĩ ngathimwo na ngamũkĩrwo wega mũno na ngaheo dawa.
Kama CHV, hii kazi nimefanya tangu 2011 mpaka saa hii, na hiyo kazi naipendelea sana. Kwa kuwa naingia kwa boma, naenda napata mwenyewe, tunaongea naye mambo ya afya, na kama kuna masomo tumesomeshwa huko na madaktari, tunaifikisha kwa community ili tuzuie watu kuenda sana kwa hospitali. Juu sana tukizuia magonjwa kutoka huku mashinani, hospitali hakutakuwa na watu wengi. Sasa tutakuwa tunaenda tu na watu wenye wanahitaji kuona daktari, ni wale tu wanataka matibabu ile yenye hatuwezi zuia huku kwa community.
Mimi naitwa Pastor Francis Muruga Kariuki. Mimi ni mzaliwa wa hapa Majengo ya Nyeri. Mimi ni community health promoters ambaye natumikia watu wangu wa hapa Majengo. Kijiji yangu kinaitwa Wetemere Village. Watu wa Wetemere ndio huwa nahudumia. My link facility ni Nyeri Town Health Center, na nimekuwa volunteer ama CHP kwa muda wa miaka 13 sasa.
The journey of being as a CHP, it has been a long journey, having some few challenges, and also motivation from the community members, because we have been engaging with the different health facilities at different levels. So we have been in a good journey, so that we are in a good position to link the community members with the health facilities.
Tangu nikuwe community health promoter, huwa najivunia juu nishabadilisha maisha, na tuseme kuanzia venye kwenye community kulikuwa, sahi hakuko hivyo. So yani yangu kujivunia ni kusema kwenye community imekuwa juu kuliko venye tulikuta tukianza community health promoters. Juu hakukuwa na show, wengi wamejega choo, hakukuwa kusafi. Tuseme sahi at least kumekuwa kusafi.
Whatever inspired me to this is there was a lot of problems in the community, and so I realized that maybe I can give a hand and help the community to lift their hygiene. And at the same time, I realized that maybe I can help them to reduce the kind of the diseases that were there.
As Nyeri County, we have 2,510 CHV, that is CHP, community health promoters. These community health promoters are deployed across the county, across 251 villages, each village has 10 community health volunteers. We have been supporting the community health promoters. Initially, they are called community health volunteers because the work they do is they are not on monthly payment.
The CHPs at the county level, they have, beyond being given the tools of trade, that is ensuring that they have first aid kits, they're able to screen for diabetes and also for hypertension. They are also able to visit households, for instance, do deworming, ensure that they do vitamin supplementation. They've also been empowered through His Excellency's program of getting a stipend. So they usually get a stipend of about 2,000 Kenya shillings. And the county also pays for them NHIF. So we believe that even with what we are going to get from the support that we are also going to get from the national government, then is also going to make it now much better.
Kama community health promoter, huwa nashukuru madaktari wetu, serikali kuu na county kwa kuwa huwa wanatuletea hiyo masomo. Wanakuja wanatuelimisha, na sisi tukipata hiyo masomo tunapelekea wananchi.
We have been supporting them in terms of providing them with the kits. The county has been buying for them a glucometer and also the strips and also the machines, the BP machines, for them to assist the community to carry out, early detection within the community. And also we have been training them because, they are doing a very important work, and because they are not medics, so we must give them a basic training for them to be able to assist the community, because they live with this community, so they understand them. So we train them so that they can be able to do that basic things that they can be able to assist the community.
Nafurahia sana kwa sababu hata saa hii mahali tuko kwa mlango wa hii familia ambayo siku ya leo najivunia sana, na ninafurahia sana ninapoingia kwa huu mlango na kukuta ya kwamba the lady ambaye ni mwenye hii nyumba leo hii ako uhai. Mimi nafurahia sana na ninajivunia sana kwa sababu huyu dada amekuwa na ugonjwa wa kupandisha damu kwa muda mrefu. Tangu nilipogundua hivyo, nimekuwa nikimpima kila siku, na wakati mwingine huwa inaenda juu, inafika mpaka 240 kuenda juu 245, na ukiangalia ile ya chini unakuta iko 100 na 10 na kitu. Moyo pia inapiga sana karibu 200 na kitu. Kwa hivyo mimi najivunia sana kumuona kwa sababu juzi nimekuwa nikimhudumia akiwa pregnant, na pia akiwa pregnant damu ilikuwa pia inakimbia kwa hicho kiwango. Siku ya leo huyu dada kuwa na mtoto na kuwa ako uhai na mtoto wake ako na afya nzuri, mimi ninajivunia sana, na ninaona ya kwamba nimefanya kazi mzuri, na ninaamini ya kwamba kupitia kazi yangu na kuwezeshwa na nguvu za Mungu, ndio maana huyu mama ako uhai na mtoto wake ako na afya nzuri.
Hamarita mako jeta wani gathigia na jikaraga mwena wa itemere Nyeri. Nigoretwo na thina wa murimu wa BP, na Francis ni ndamwirire thina ucio akinyitirira akinyonia njira iria nguthi na mbere tondu ni akoragwo iguru muno. Ndida mwana uyu ri ndathiaga thibitari ngakoraga ndiraringa 200 o we akandwara akindwara ngambia kunywa ndawa kiuka wega ngithii kugia mwana uyu ri kiringa 240 ngikorwo nginya ni nderigwo. Francis ni okaga kundora akinyitanira na madagitari macio kinya ngithondekwo gicoka thi, no na riu bado no nyuaga ndawa.
Kama hauna ile passion, hauwezi kuwa community health promoter. Juu lazima ukuwe na ile call, nitapigiwa simu niambio fulani amegojeka, kuna mama mjamzito ameshikwa na uchungu, tutampeleka hospitali aje. Ile ni kazi ya kujitolea. Kwa hivyo pale tuseme huwa tuna jaribu kutoshanisha hiyo mambo. Juu lazima utumikie watu. na uliwaonyesha mimi nitawatumikia, hakuna malipo.
We have been training them and we will continue as a county supporting them in terms of providing them with refresher, because learning is a continuous process, and we shall continue supporting them. Of course, there has been a challenge. You know, the money is never enough. The resources is scarce. But going forward, we have included it in our development plan, the county integrated development plan, the CIDP 2023-2027, for us to support them in all the requirements they may need for us to ensure that their work is sustained. Because this will go a long way to ensure that, you know, at the national level, at the policy level, there's a plan to make sure that we now focus on the preventive side through the primary care network.
I think why we have a very robust community health promoters program is that the first I mentioned about the goodwill from His Excellency the President, and we always had the instruction to recognize them as a key pillar in the delivery of health services in Nyeri. We have actually, in their leadership, we have elevated their coordinator to the level of a county manager, so that they are not managed at the lowest level, but managed at the highest level. In so doing, we make sure that, as I said earlier, their stipends are on time, and to really improve on themselves, we have programs that include income-generating activities. We have one at Rogoro Health Center in Madeira, where they are even doing beekeeping as part of their income-generating activity. And we expect that this will go a long way in extending to other community health volunteer groups, so that they are not relying on the stipends alone.
Gikundi kia CHP herega nitwethire undu uria tungihota gwiteithagia, tukiona no turithie njuki, na twageririe uguo riria twageririe tugithondeka miatu wa mbere wa keri wa gatatu, tukiona ni tura benefit kaundu kega, na tukiona undu ucio ni wagiriire, tukiambiriria guthondeka miatu ta CHP. No twathii uguo riria twambiririe ku harvest, ni tuonire hari na uteithio munene muno, tondu ithuya rimwe ria uki ni tuhotaga kuona 20,000. Koguo tukiona undu ucio ni mwega na tugithie na mbere.
Hii mradi yetu ya income generating program sio ya samani, sababu hii ndio mwezi ya 7 wakati tulianza. Kwa hivyo isipokuwa ni hii mboga tumeuza, na hata hatujauza kiwango ya kusema ati hata tumerudisha ile pesa tulichanga ya mbegu. Miti hatujauza. So ni very new project, lakini our aim is to add to our stipend something else beyond that. So tunapenda tu kama ni misaada, tukipenda tuongezewe. Charges ya tubes ni sisi huwa tunachanga pesa. Kama ni mchanga tunatumia ile tu tulikuta hapa, lakini ile mchanga yenye inafaa kwa nursery inafaa itoke kwa msitu ndani huko indigenous trees, pahali wameweka borea siku miaka mingi, tunaokota hiyo, tunakuja tunatumia hiyo, ndio hiyo vitu tunakusa inakuwa haraka.
At the moment the challenges are much less. Addressing the positive aspects, the challenges has been in the provision of the diagnostic kits, the CHP kits that contain the blood pressure machine, the thermometer, they contain some blood pressure machine, glucose testing machine, and a few others that can do some little emergencies. For now, as we stand today, we have received enough of these kits from the national government, from the project that was launched by His Excellency the President last Monday. So we are now waiting as a county to organize ourselves to dispatch them. So that addresses largely the main challenge that have been there. The other challenge has been on logistically receiving their stipends, and that one has been streamlined. And we are expecting, as per the projected going way forward, that the national government is going to combine efforts with the county government and increase the stipends of the community health promoters.
Financing Alliance for Health is currently supporting Nyeri County to co-develop a community health strategy. And the reason as to why we do develop costed strategies for governments is because despite the national governments developing strategies and policies as their core responsibility, the social, economic, and political context vary from one subnational government in Kenya to the other. And that's why we find it necessary for us to support the governments to co-develop and cost their strategies.
In terms of the community space, we've also had, we've been working this journey with the FEH, and that is Financing Alliance for Health. And in that journey, we started first by coming up with a costed implementation plan, which is basically just a roadmap of looking at what are the gaps, what is it that we need to do to ensure that we take community health to the next level. And that document has since been completed. Now we are looking at other aspects, including implementation of the same. And within that document, there are certain asks that we had made also to FEH, and one of them is that we need to strengthen our community health units and community health committees. And our last request was on training of community health committees and ensuring that they also link to the facilities, that is the health facility management committees, because we've just appointed new committees, so they also need sort of to be inducted and they understand what is the link between them and at governance level, what is the link between them and the facility management committee and the community health committees. So, but there's a lot that we look forward to working with the FEH in strengthening community health. We'll also be bringing them on board as we start the establishment of the primary care networks, because all this is still in the same space. So we really look forward to ensuring that the various support that we can get, especially in advocacy, ensuring our leaders understand what PCNs are all about, because that is also going to be key in ensuring that moving forward we have better allocation and we also have even better understanding within the community leaders.
By and large, what we want to do is to scale up what we are doing now, but we are waiting for the Community Health Bill to be enacted, at Community Health Act, so that we can actualize it. The first is to really train them again, because they need to be trained on the upcoming issues all the time and expanding their knowledge. We are also advising them that those who have papers, the county can help them to fix in some other more training beyond the community health volunteers. We are going to scale up their income generating activities, and we are going to keep on in the long term agitating for their stipends to be increased both ways, from the county and from the national government, as long as the available economic environment can allow.
Once, I would say I'm very grateful to the government because of the type of the stipend they have given us for those years. It has helped us here and there, but due to the way the economy is, I would just humbly request them to give us enough so that we can assist the community and maybe uplift our standard.
I wish to have a small message to the youth in our community. First of all, I'm the youngest CHV, our community health volunteer in Nyeri County and also here in Nyeri South. And I wish to urge them I'll encourage them to join or engage themselves in the community health. This is where they will be in a good position to deal with mental issues, depression issues, and also different opportunities that they will be able to face when they are engaging themselves with the County Department of Health Services.